Thank you, Chairman Sanders. Thank you for your leadership on this issue, because the potential of medical innovation is very real. It is the promise of a diagnosis. It is a treatment. It is a cure. Research is medicine's field of dreams from which we harvest the findings that give hope to families that there will be a cure for that disease that's been running through their family's history. And groundbreaking medical research and innovation gives patients that hope that their child's illness will be healed, that revives people from overdoses, that prevents a cancer diagnosis from being fatal, and pulls us out of the darkest days of a deadly pandemic. Understanding the promise of medical innovation, Merck and Johnson & Johnson made promises to the American people. Founder George Merck once stated, quote, "We try never to forget that medicine is for the people. It is not for the profit." Robert Wood Johnson wrote in Johnson & Johnson's credo that, quote, "They must constantly strive to provide value, reduce their costs, and maintain reasonable prices." But there is nothing reasonable about what we are seeing before us today. These companies walked away from these grounding principles, and when given the choice of delivering for their shareholders or for the health of the American people, we have witnessed time and time again these companies put profit first. Simply put, these companies care more about their wealth than they care about America's health. Drug companies putting profits first fueled a national opioid epidemic, creating a tsunami of addiction and death. It turned up the dial on American drug prices, despite the same drugs selling for a fraction of the price in neighboring countries. Diabetes drugs cost $6,000 in the U.S., yet only $900 in Canada. Cancer drugs in the United States are 4 times the cost of the same exact drugs in the United Kingdom. It created so-called Blockbuster drugs that rake in billions for these companies, lining the bank accounts of shareholders, while over 30% of Americans are not taking their medication as prescribed because of the cost. This is really a story of accessibility. It's an hallucination to believe that drugs which are on the counter but not affordable are accessible to ordinary Americans. That's what this debate, this discussion is all about. People with diabetes, asthma, cancer, dementia, they turn away from treatment because they can't afford it. They ration their medication and end up in bankruptcy due to the drug and other health care cost-related issues. So we have seen medical innovation, and I support it. But innovation that costs so much that it puts hope out of reach instead of putting it into hands of families isn't really innovation at all. It is a cruel reminder that we are living in a sick care system in our country instead of a health care system. And companies want to keep it that way. But this is not inevitable, nor is it politically incurable. That's why this hearing is necessary. We have to demand that these CEOs explain to the American public why these prices are so high, why they are so inaccessible to ordinary Americans. We can create a healthcare system worthy of the American people when pharmaceutical companies take a seat at the table and deliver innovative, groundbreaking medications at a price that the American people can actually afford. We can guarantee that the innovation that these companies promise can be realized by every American, no matter their income level. I thank Senator Sanders for calling for a hearing. which will be an opportunity for these companies to take a seat at the table, to work with Congress on how we can move forward together to deliver for the American people, to deliver for their families' health and well-being, and to turn our system from a sick care system to a health care system for everyone. So I thank you, Senator Sanders.